Hi guys, Beulah Scott, occupational therapist.
Mike the PT.
Oh, Mike the PT, that's a new one. Okay.
Shorten things up a little bit.
For any of you that don't know, that's physical therapist. He's shortening it up. Okay. So today we're going to talk about hot and cold therapy. And so often we get the question, like whether it's from friends, family members, as to whether I use hot or do I use cold therapy, which one to use, and stuff like that. So I thought that's a good topic for us to kind of talk about.
Yeah, there's a lot of confusion. All of my patients, that's usually one of the questions they ask me on the evaluation the first day that I see them. So we'll go over some of the rules. Well, there's only actually one rule that's important.
So, before we get into that there, I wanted to just say, if you can go and subscribe to us on YouTube and like us on Facebook and share this. And so let's get that word out so we can get as many likes. So we're kind of just looking to get more likes. So with that said, I guess we can go into talking about the hot and cold therapy, when to use it. And I thought it ties into last week's conversation about the stress and anxiety, especially when it comes to the heat therapy, but we'll talk about that later. So why don't you go ahead and tell us about the
one rule there is?
Yep.
The only rule there is when you have an acute injury, such as you step off the curb wrong and you twist your ankle and your ankle's swollen, it's hot, it's painful, that's an acute injury. Or you injure yourself playing tennis and you get tennis elbow and it's swollen and painful. For the first 48 to 72 hours after that injury, you have to use ice during that time period. We recommend rest, ice, compression, and elevation.
And that spells rice, I guess. So that's a good way, right, to remember
rice.
Is the rice. So usually after an acute injury, we kind of want to use the rice thing. So
I tend to, if it's an injury where there's still visible swelling around the area, I would keep ice a little bit longer until that swelling's down pretty good, because the heat may tend to increase the swelling in the area. But if the heat does give you more relief, then after 48 hours, you can do whichever one feels best.
So with heat, what we're getting at is with heat, you have the vasodilation, and what happens there is you having that increased circulation to the area. So that's what's happened with the heat. And can you tell us about ice and how that works?
The ice during that time period with the swelling, you'll get vasoconstriction there. So that's going to shunt some of the blood and the fluid away from the area and help reduce the swelling and numb the area as it's doing that.
And when it numbs it, that's how it relieves the pain. So that's where, the two. So once you pass that, the 48 to 72 hours, you can either use heat or ice, whichever way at that point, whatever you choose. And we typically recommend 15 to 20 minutes. And I think that's an overall consensus in the therapy world, or, with physicians and stuff like that. Some people may recommend otherwise, but that's a consensus between the 15 and 20.
To 20 minutes, especially with the ice. You don't want to leave the ice on too long because you can cause some cold injury to the area. It wouldn't go as far as saying frostbite, but it can get.
I would say frostbite.
Be going
close.
Towards that, yes. You don't want to leave that on too long. And then, other than that, it's what you decide gives you the most relief. As a physical therapist, I've found for arthritic conditions, chronic aching pain from that, 9 times out of 10, the heat works better than the ice. I can't explain to you why. It just gives the patients, I think, more relaxation of the muscles around the area.
And the joints.
And it calms the joint down. Occasionally I find someone that in that situation that does like ice, but it's not
Yeah.
very common.
That's not very common. Most of the time with that is heat, for the arthritis. So, and so if we're looking at that in terms of like applications, we want to make sure when you apply either one, you apply them safely too. So, we have like what we call the moist heat, right, in our clinic that we use as moist heat, and this one's for the cervical area that we use, but this is submerged into a hydroculator, and then we kind of use that, and typically we would use that with a towel. So you want 4 to 5 layers at times to cover the heat with that. But then, some people have ones that they put in the microwave at home. So you want to make sure you have a towel, between your skin and the heat to make sure that you don't burn yourself. And then, comes to the electric pads.
Yeah, that's electric heat is very common. The ones that have different settings, you need to be careful about turning it to high when you sit on it. If you're gonna sit in a chair with it behind your back, that's a very common use for it. If you turn it on high and then people tend to doze off as they start to feel better, and you leave it on high, it can burn the skin. It can cause second-degree burns. I've seen it cause severe wounds in patients before.
Wow.
Yeah,
that's pretty bad.
It can get deep in the tissue. So keep it on a moderate range if you're gonna sit on it with it behind your back.
And then that too, when you if you're gonna lean against it or sit on it versus it being on top of you, you have to make sure that you have enough layers, because when you're pressing against it, that heat is a lot more than if you're laying down and you have a hot pack on your back. So you want to make sure then if you're sitting against it or on top of it that you have some good layers there to prevent that.
The heat will be more intense in that situation. So.
And when with ice, the same thing, you have to protect your skin against the ice. And we have these pads, but there's various ones. There's the gel pads that people typically have, at home. But we always, quick and easy, just put a pillowcase.
You can see how cold it is from the freezer. You have the frost on there. So you can't put that right against your skin, because that can cause damage like we spoke about before with the frostbite. And it can make things worse for you if you do it that way.
So putting that on there simply puts
just a
that
little
layer.
pillowcase does that for you. Yeah.
And that works effectively for us in here, whether we're doing it for the back or for your foot or shoulder, regardless. Hand is just putting that ice there. The pillowcase, the layer of that there. So, and you have, a variety of different ices, and that we'll talk about in another thing, where you can put ice in a cup and, freeze it, and then
It's called an ice massage.
An ice massage, where you can do an ice massage. But that's, a topic we'll talk about another time, actually, how to apply that and when to use it and that. But using it is also after an acute injury or...
Well, yeah, we don't want to get too deep into it. That's great with tendonitis and things like that. But,
so that's just, the various methods. Is there anything else that you think we missed, maybe, with regards to the ice and heat and safely to apply it? We went over the 15 to 20 minutes, making sure that, you don't keep it on too long. And then, obviously, the big one is the electric heat that people may fall asleep on. Make sure.
Gotta be careful, and you don't want it on all night, that's for sure.
So a quick summary of that is you want to use the ice with acute injury within the 48 to 72 hours after that. And then after that, you can apply either the heat or the ice, whichever one works for you. And, typically when you have joint pain, or if you're having arthritic pain, and that you'll use the heat for that, and that really makes it feel good. And then also we just missed the one of the stress. just using the stress for stress. If you have stress or
A lot of
tension,
people, a lot of people carry their stress in their shoulder muscles up here, your upper
Yeah.
traps and your neck. 15-20 minutes of heat on your
Heat on
shoulders
there.
here will help relax that down, you know, and do the things we talked about last week with the stretches.
I almost
And-
completely forgot about that one. And that's what I
Yeah.
said we were going to talk about.
Yeah.
But yeah, applying the heat to that really calms you down. It's a calming effect, and also, you know, relaxes the muscles a lot more. So heat can be used for that instance. So I think that covers it. Next week we're going to talk about the actual making of an ice pack that you can make at home, and there's some quick and easy recipes that we're going to use, and we'll talk about that. So thank you for taking the time to listen, and like us once again on Facebook and subscribe to us, and we'd love to have more likes. Thank you.